Hi, I'm Dr. Nova Rodriguez, your trusted guide behind life health secrets, dedicated to simplifying complex medical topics into clear, practical advice. My mission is to help you understand your body and take control of your health, one simple secret at a time. Close your eyes for a moment. Inside a woman's body, something extraordinary is happening. She may feel tired, she may feel nauseated, she may not even look pregnant yet, but inside her womb, a heart has started beating. Tiny fingers are beginning to form. The brain is developing at lightning speed. A human life is quietly taking shape. Welcome to pregnancy weeks 5 to 8, the most critical, fragile, and miraculous weeks of early pregnancy. Today, we'll explore what's happening inside your body, how your baby is developing day by day, why symptoms feel so intense, what precautions you must take, and the emotional journey no one talks about. Let's begin this incredible journey. From week 5 to week 8, your baby is called an embryo. This period is known as organogenesis, the formation of all major organs. This means brain, heart, spinal cord, lungs, liver, kidneys, limbs, eyes, ears, all begin forming in these 4 weeks. This is why exposure to alcohol, certain medications, radiation, severe infections, uncontrolled diabetes can cause congenital abnormalities. During these weeks, even a small harmful exposure can affect organ development because the blueprint is being written. Heart development, week by week. Week 5. The heart begins as a simple tube. Week 6. It starts bending and looping. Week 7. 4 chambers begin forming. Week 8. Heart valves start developing. Week 5. The heart begins. Baby's development. At 5 weeks, baby is about the size of a sesame seed. The neural tube is forming. This becomes the brain and spinal cord. The primitive heart tube begins to form. The placenta starts developing. And here's the miracle. By the end of week 5, the heart may begin to beat. It's not fully developed yet, but it's beating. A rhythm. A life. A beginning. Mother's body changes. Hormones are rising rapidly, especially HCG. You may feel missed period, breast tenderness, mild cramping, extreme fatigue, frequent urination, mood swings. Why so tired? Why so bad trying, right? Because your body is building a placenta, increasing blood supply, supporting embryo implantation. It's like running a marathon silently. Week 6, morning sickness begins. Baby's development. Now your baby is about the size of a lentil. The heart is beating 120 times per minute. Brain divides into major regions. Eye spots and tiny ear indentations appear. Arm buds and leg buds begin forming. Your baby doesn't look human yet, but the blueprint is complete. Every major organ system has started forming. Mother's symptoms intensify. Week 6 is often when symptoms become strong. Nausea, morning sickness, but it can last all day. Food aversions, heightened sense of smell, metallic taste, bloating. Emotional sensitivity. Why nausea happens? Because HCG peaks rapidly, estrogen increases, digestive system slows down. It's uncomfortable, but it's often a sign that pregnancy hormones are rising properly. Week 7, tiny movements begin. Baby's growth. Size, blueberry. Brain grows rapidly, about 100 brain cells per minute. Heart now has chambers. Tiny hands develop paddle shapes. Facial features start forming. Umbilical cord clearly visible. If you do an ultrasound this week, you may see the flicker of a heartbeat, and that moment changes everything. Emotional story. Imagine a woman lying quietly during her first scan. She's nervous. She's scared. She doesn't know what to expect. Then suddenly, a tiny flicker appears on the screen. That's the heartbeat, the doctor says. Tears fall silently. In that moment, she doesn't just feel pregnant. She feels like a mother. Week 8, now called a fetus. This is a huge milestone. At week 8, baby is now officially called a fetus. Size, raspberry. Fingers and toes separate. Eyelids form. Brain waves begin. Internal organs continue developing. Heart beats around 150-170 times per minute. The risk of miscarriage starts slowly decreasing after this week. The foundation of life is laid. By week 6 to 7, heartbeat can often be detected on transvaginal ultrasound. Heart rate 110 BPM at week 6, 150-170 BPM by week 8. Imagine telling your audience, your baby's heart is beating twice as fast as yours. Brain development, extreme growth. The neural tube closes around week 6. If folic acid is deficient, risk of spina bifida. Neural tube defects increase. By week 8, forebrain, midbrain, hindbrain are clearly forming. Neurons multiply at an incredible speed. This is why folic acid is not optional. It is essential. Limb development. Week 5. Tiny limb buds appear. Week 6. Paddle-like hands. Week 7. Elbows form. Week 8. Fingers separate. Your audience will be amazed knowing the fingerprints begin forming as early as week 8. Internal organs forming by week 8. Liver starts producing blood cells. Kidneys begin forming. Intestines develop. Lung buds appear. Pancreas starts forming, important for insulin later. Even though these organs aren't fully functional yet, the structure is laid down. What happens to the mother internally? Let's go deeper physiologically. 1-HCG hormone peaks, responsible for nausea, vomiting. Positive pregnancy test levels double every 48 to 72 hours early on. 2 progesterone effects relaxes smooth muscles, slower digestion, constipation, bloating, acid reflux, but it also protects the uterus from contracting. 3. Blood volume expansion. Your body begins increasing plasma volume. This prepares for placental circulation, oxygen delivery. Severe morning sickness, hyperemesis gravidarum. Some women experience extreme vomiting. Signs: cannot keep fluids down. Weight loss, dehydration. Weakness. This requires medical attention. Explain compassionately. Morning sickness is common, but suffering silently is not necessary. Miscarriage risk. Educational and sensitive section. Most miscarriages occur in the first trimester. Common causes: chromosomal abnormalities, hormonal imbalance, thyroid disorders, severe infections. Reassure your viewers, it is rarely because of lifting something or walking. This reduces unnecessary guilt. Detailed nutrition plan. Advanced. Daily essentials. Folic acid, 400-800 mcg. Iron, 27 mg daily. Calcium, 1,000 milliliters, vitamin D. Protein, 60-75 grams daily. DHA for brain development. Foods to highlight: spinach, lentils, chickpeas. Eggs, milk, almonds, salmon. Low mercury. Citrus fruits. Hydration, 2 to 3 liters water daily. And mental health and anxiety. Weeks 5-8 can feel overwhelming. Women may experience fear of miscarriage, fear of telling family, body image concerns, work, stress, sleep disturbance. Explain: hormones amplify emotions, support system matters, and Siersachi encourage talking openly. Light walks, relaxation, breathing, limiting Google anxiety, intimacy and safety. Many couples ask, is intercourse safe? Answer: yes, if pregnancy is normal and doctor hasn't advised restriction. Avoid if bleeding, placenta problems. History of recurrent miscarriage. Doctor guided. This increases engagement because many people are afraid to ask. Warning signs. Very important segment. Seek immediate medical care if heavy bleeding, severe abdominal pain, shoulder tip pain, dizziness, fainting, high fever, severe dehydration. Explain ectopic pregnancy signs gently. Emotional story segment. Fatima didn't feel pregnant at 5 weeks. She just felt tired. At 7 weeks, she saw the heartbeat. At 8 weeks, she held the ultrasound photo close to her chest. She wasn't just carrying cells anymore. She was carrying hope. Growth size comparison, visual section. Week 5, sesame seed. Week 6, lentil. Week 7, blueberry. Week 8, raspberry. Safe exercises allowed. Light walking, prenatal yoga, gentle stretching. Avoid heavy lifting, high-impact sports, overheating, sleep changes, progesterone causes, daytime sleepiness, vivid dreams, frequent urination at night. Encourage side sleeping, extra pillows, short naps. Why this period defines the future. By week 8, all organs exist. Heart is pumping. Brain is developing rapidly. Placenta is taking over hormone production soon. This is the foundation of human life. Ending. Weeks 5-8 are invisible to the world, but inside, a tiny heart beats. A brain forms, a future begins, and inside one woman, strength rises quietly. She may feel sick, she may feel scared, but her body is building life. And that is extraordinary. If you like this video, please share, like, comment, and subscribe.